So thank you so much for the opportunity to be with you here today. I have to say I'm slightly nervous and intimidated now. You all did such great jobs of presenting this morning that it's a hard task to follow. But I'm a children's nurse by background, and I worked clinically for about 11 years looking after children recruited into clinical trials across 20 different clinical trials in 4 different therapeutic areas. And it's kind of on the basis of my experience as a children's nurse and later as a regulator that I started to look at using technology to improve the way that we captured patient-generated data during clinical trials. So what is patient-generated data? I mean, in a simple way, it's everything that patients themselves report and that is not interpreted or reported by anybody else on their behalf. So it has to come directly from the patient and is not allowed to be sort of interpreted in a different way, possibly by the doctors or other healthcare professionals. And that's an area that I'm particularly interested in because through my experience clinically and as a regulator, we realized that capturing clinically meaningful patient data was extremely difficult. And the problem was that we would very often choose endpoints for clinical trials that were very medical and not always reflective of what patients said that they found difficult every day. So numerous of the clinical trials that I was involved with, patients or families would say to me, why have you picked that as a primary endpoint for that clinical trial when it has no relevance or no importance to what I struggle with on a day-to-day life? And to make it worse, patients come into clinical trials on a sort of 3-monthly or 6-monthly basis, and it's a very snapshot, episodic insight into what patients experience. And a lot of what they really go through is missed. And what we were looking at was to consider how can technology fill the gap in terms of reporting this missing information, particularly if you consider that only 1% to 3% of a patient's experience is captured in electronic health records or clinical research records. And so we really want this sort of patient-generated data and particularly sort of digital biomarkers and sort of technology-enabled data, patient-generated data, to be used to improve the patient insight, engagement, and to kind of increase our understanding of the disease and what it's like for patients to be living with that disease. So what we've got is a software platform that captures multiple different types of patient-generated data. On the phone app, there are 4 features. One is visit, so to tell you about appointments coming up as part of your clinical trials and what to expect as part of your visit. But you can also record if you're attending any hospital visits. One is patient-reported outcomes, so you get notified with a little symbol on your phone when it's time to complete questionnaires about quality of life or patient-reported outcomes. One is recording your symptoms in real time, so it's a very simple pre-configured one with symptoms that are relevant to your disease. And hopefully by recording it in real time, it means that you don't sort of have a memory recall, so trying to remember the exact details when you see your appointment, see your doctor in your clinic appointment. And then one is medication adherence, so you get prompt to when to take your medication. But most importantly, you get given the opportunity to say that you didn't take your medication and the reason. So we know that taking medication is a really complex routine, and medication adherence is not just about whether you remembered to take it or not. It's very often associated with sort of the side effects that come from it, or just the belief that the drug doesn't work for you, and those kind of things. And then if it's suitable, we also offer a wearable device that patients wear with it. It comes with alerts and notifications. You can do video consultations between visit with your doctor. We can integrate things like pollen and pollution into it if those environmental factors can have an impact on your disease, and it can be integrated into other healthcare records. So these are the studies that we've completed or have ongoing at the moment. We've deployed studies in India, America, South Africa, and here in the UK. So it's available in multilingual options. And you'll see that it's kind of quite a strong pediatric rare disease focus in its current uses. So I'm just going to talk a little bit about our experience, and at the end then kind of ask you some questions about your thoughts. Because I should go back, sorry, just to explain that although we do have a very strong pediatric focus, some of these studies are actually in adults. So the eldest patient that we've had recruited is 65 years old, and the youngest patient that we've had recruited is 5 years old. So we've had a huge, wide varying age group and also cultural difference in terms of those recruited to our studies. And we've kind of been surprised by the interaction, engagement, compliance, depending what you want to call it, that we've had. So I'll go through it in a bit more detail, but the prompted engagement where it sort of had alerts were the best ones, in the fact that you had really good response overall. So the symptom and independent reporting that was not prompted was very, very variable, not only across different diseases, but within each study in itself, whereas some patients were using it very actively and others didn't engage at all. What clinicians told us that they were really surprised about, that they uncovered information that they previously didn't know about patients or about cohorts. So the technology was used to report symptoms that patients either didn't have the time or didn't remember, or possibly were too embarrassed to admit it in clinic, and used the tool as being a way to communicate those things. So if we look at the various interactions, so from the patient-reported outcome, so this is one where you get an alert of when to complete the one, we see that actually across the adult group, the mixed group, or the young people group, it's generally sort of the similar. So the percentage of people that complete the PROs within the same day that's been issued, or within 3 days, is kind of similar. But then for the non-prompted engagement, so this is just for symptoms, we see quite a different. Now this could be not an age-related thing, this could be actually a disease manifestation thing. So late onset Tay-Sachs was the one with adults, but it's actually a much more severe presentation of disease, you could say, for some patients than the juvenile idiopathic arthritis group, which was the children and young people one, where we had very sporadic or very little non-prompted symptoms reported. And then for the Gaucher disease, it was initially a high engagement, but that's then dwindled over duration of the study. I've already touched on this, but allowing what we'd configured was symptoms that were very easy for patients to report. So symptoms relevant to the disease, but they only had to click 2 or 3 times on the app to actually report them and quantify them. But interestingly, it was the other button, so the free text one that patients enjoyed, or I'm not sure enjoyed is the right word, utilized the most in terms of having the freedom to write their own symptoms in their own words. And that was far more popular than we'd expected. And then when we look at the wearable device, this is where we actually found some really interesting differences. Where the adult group with the Tay-Sachs, where the youngest patient was sort of 35 and the oldest person was 65, we actually had a really high engagement level. So at the youngest, at the lowest engagement, I should say, is 26%, but it was sort of sitting around 74%. And if you compare that to the teenagers, we had really low engagement with the teenagers, so they didn't sort of wear it anywhere near as much as the older people. And we sort of saw in the mixed group that was sort of half that. And I guess what we sort of anecdotal evidence or things that the doctors were telling us, that when the patients, the teenagers in particular, had signed up to take part in the study and been promised a wearable device, they had kind of thought it was going to be an iPhone watch. So slightly disappointed when they got a slightly more boring, dull watch. And this paper kind of reports on how important it is that it sort of looks and feels good, and we've sort of gone on to call it the bling factor. So some of the challenges that we've experienced. So wearables are actually easily lost or damaged. So across our studies, we've had our wearables end up in the bath, in the washing machine. We've had a dog eat through it. And so this does create quite a logistical challenge in terms of replacing those wearables and not missing out on a lot of the data. And supporting patients, what we obviously don't want is that doctors and nurses and healthcare professionals' time is taking up supporting the technical aspect of this. And so it's required a close collaboration and cooperation from our side to be able to support the patients in making sure. We also understood that obviously not all patients are tech savvy, so the sort of downloading apps, linking to wearable, using them with a notification didn't come sort of easy to everybody. But as I illustrated before, the sort of assumption that children and young people are more tech savvy and therefore likely to engage is definitely not a clear-cut assumption. And much like transition care, that sort of teenage years where in transition of care and maintaining sort of medication adherence, we saw similar challenges in actually engaging with our technology as well. So where do we go from here? From our point of view at Apparito, we've sort of changed the technology quite a bit from the initial deployment that was done in one of our first study, and that sort of taking on board a lot of the experience that we've had in the studies that we've done so far. I should have explained that we actually did a lot of work with all the patient groups before we even deployed the study. So we did webinars, focus groups, online surveys with the patient groups to sort of understand what they wanted in terms of the technology and how it should work. But interestingly, even that didn't always lead to those aspects of the technology being the most popular ones to be used. And so we sort of realized that there are some learnings that are applicable across all the board, but actually some issues that are very, very disease specific and can't really be translated from other diseases to sort of a standardized cross. So it's not a sort of one size fits all, and it's something that generally needs to be considered at a disease level, but also on a study level. So we found that studies that were sort of less than 6 months were actually quite, I say, easy to manage. But when you go beyond 6 months and beyond 12 months, you also need a different strategy in terms of maintaining that engagement to ensure that you're getting this long-term data that comes through it. So I'm going to do a couple of questions now because I'm really interested, especially after all the week that you've had, to sort of consider some of the questions that I would like to sort of get your feedback on and to learn. So I don't know if any of you have used Slido before, so they should be on Slido if anybody wants to download it on your phone. Slide.do.com, and then there's an event code that should be there. But I mean, if I was also thinking that if it's not easily accessible, we could just sort of look at the questions and hopefully get some feedback from you. Now I know that you're all very confident of public speaking. I'm kind of looking forward to so it's slido.com, and the code is, I don't know if you can see it, sorry, hash X975. Oh, is it? Not, okay, sorry. Without the dot in the middle. Okay, yeah. So without the .com at the end, so with just the Slido. Yeah. And the code should be hashtag X975. Has that come up? Or not? Hashtag X975. No? Oh, is it just slow Wi-Fi maybe? So for those that can get it, the first question is about understanding, do children and young people want to use their phones to communicate health information? And some of the insight that we've been getting is that actually children and young people want to keep their phones for fun socializing events, and they don't want their phone to be associated with health reminders or boring alerts or things that kind of stops them associating their phone with being a socializing tool, a fun tool. And so what I'd be interested to hear from you is whether you think, yes, that children and young people would be interested to use their phones in communicating this health information, or no, you want to be able to protect your phone as your sort of safe sanctuary for fun and socializing only, and not have it as a sort of one for... so I don't know if there's anybody that's brave enough to comment or to answer. If we maybe went for a hands up, who think yes, young people would want to use their phones to communicate health information? So majority are yes. Anybody that thinks no? So no, nobody. Okay. And who would think that you find it easier to share health information with your doctor via phone app rather than face-to-face? So again, some of the feedback we've been getting is that sometimes a face-to-face consultation is really embarrassing, and it's difficult to explain some of your symptoms honestly, whereas using your phone could be an easier way of communicating your symptoms with your doctor. But other people feel that it's really important to have that face-to-face time with your doctor, and that actually using technology wouldn't be a good tool to share your symptoms. So who would think, yes, they would prefer or they would find it easier to share the health information via phone app? Cool. And who would think no, that they prefer that one-to-one face-to-face time with their doctor? Okay. And those that haven't voted, what do you think? Is there any thoughts?
For me, it would depend on how quickly the doctor replied. Yeah. And so if they replied quickly every time, you'd build confidence in that. But if it took them a week to get back to you, you'd be concerned they weren't reading the information.
Yeah. Also, I would say, like, sometimes it is easier to write things down if it's maybe a little bit embarrassing, but also it might be difficult to explain your symptoms by writing it down. So it kind of depends what's going on. It might be easier to speak to someone and they can pick up on how you're feeling about it, because sometimes texting is black and white and they don't get the emotions or how you feel about something.
So a combination of the two is what we consider to be the ideal scenario, where you kind of use the technology as one to start the conversation maybe, and then have the opportunity to follow up in a face-to-face. Any other thoughts on that one? No? So then the next question, does wearing a wearable device to passively share your data with your doctor feel like a good or a bad idea? So some people are like, no, I don't want to think that my doctor can monitor me 24 hours a day, and I'd rather not be reminded by a wearable device that my doctors or health professionals are sort of tracking me in a big brother kind of way. Whereas others can see it as some sort of value to share those data. So who would think, yes, it's a good idea to wear a wearable device that can provide information to your doctor in real time? Okay, not that many. Who thinks no? So quite a few. And so from the ones that write no, you were kind of happy to share the reason you'd say no? Or? So the faff factor is a big factor. It's one more thing to have to. And then the last one is, what would motivate or encourage you to share health data with your doctors in real time? So one of the aspects that we've been looking at is sort of gamifications. But obviously, when you're a teenager, being rewarded with a sticker and that kind of thing is not necessarily an appropriate motivator. So would it be something more like a peer group? So you've got an online community with other people of your age that have the same disease or disorder, or would it be more regular video clips, information from your doctors, or would it be something completely different that would help you consider or motivate you or encourage you to share such a data via?
Not missing so much school in your education process. Not missing school for your education process so you get the right education like everyone else. And being your motivation.
Education factor was it? Sorry, I can't see who's speaking. Sorry, not missing school.
Yeah.
Okay, yeah, excellent. Did you have some thoughts as well?
I think we can create a website where you can talk with people with the same disease or that are just going to the hospital. And in this website, we can put like a survey. And I think it's important to go to the hospital, but not that much, because I was going to the hospital like once a month. And so I was missing school, and this is, I think I was upset about this. And sometimes just saw the doctor and just talk, and that's it. We don't even take a blood test, like nothing. And in this case, it would be better to just go on this website and just do the survey.
So you prefer a website to having it on a phone app as well, so you'd only go specifically on the website when you needed to? No, makes sense. Well, patient view is something that we're doing as well in terms of tracking around. So, excellent. So there were just some of the areas that we're particularly interested in terms of being able to constantly improve our technology and sort of see how it best serves this sort of age group. So Feel free to get in touch with me if you've got any further ideas or questions that you want to ask about what we've done so far. And thanks again for the opportunity to join you today. I was hugely impressed with your clinical trial proposals this morning. So congratulations to you all. Thank you.